It's BBC Radio Humberside, Lara here with you. If you want to send me a text on the jobs news today and ABP and wind turbines, it's 81333. Start it with RH. Thank you very much for the ones you've sent me so far. I'll read some of those soon and you can email me. Thanks for those emails as well. lara.king@bbc.co.uk. Now, do you work in healthcare and fancy a trip to work with the street children of India? We can find out more about this now. Tracey Clay is here with me this morning in our Grimsby studio. Morning to you, Tracey.
Good morning, Lara.
Thanks ever so much for coming in. Tracey is a former diabetes specialist nurse at Scunthorpe Hospital, and you're travelling to India, is it in March?
That's right, we're travelling out for a 3-day camp to March. I'm actually flying out on the 22nd, and I'll meet the rest of the team on the 23rd, the evening of the 23rd, to do a little bit more planning and preparation for the weekend camp.
So it's the Slumdoctor. I keep wanting to say Slumdoctor project. It's a great title, but what is it?
Basically, it's a medical camp. Now, I got involved back in 2008 when I first met Dr. Banga, who had been out to India and he'd done several trips previously. So we had a degree of commonality. Firstly, our interest in diabetes, and secondly, our interest in charity work. So he then invited me out, and my first trip ever to India was back in March 2009. It was fantastic. I really enjoyed the experience. Very, very busy time. I was quite fortunate that the company I work for funded me in terms of my flight and had some time off. But we're looking for healthcare professionals now to join us. And we appreciate that the time is quite limited now. It's only a few weeks away. But if they've got an interest, for example, a pharmacist, a radiographer, ultrasonographer, then please check out the website, which is www.slumdoctor.co.uk, and all of the information is on there. Even if they can't get this March, to think about perhaps coming in 2012, they can perhaps book annual leave, because everything has to be self-funded, and it's an awesome experience.
What sort of stuff do you do? Who are you helping when you go out to India?
Well, if you consider what happens in the UK, we have a health service which, yes, is governed by rules and regulations, and it does have its own restrictions. It has its own viruses and difficulties within the hospitals and also within the community setting. But in India, it's very different. There is no structured health service. Everything has to be paid for on an individual basis. And because my interest is in diabetes, I'll give you an example of a young guy who had been diagnosed with type 1 diabetes. And when I saw him, he had diabetes for about 6 months. Now, in the UK, what would happen is he would go to the hospital, he would be given insulin for life, free, and he would be taught how to inject, and he would be educated. In India, that's very different. His mum actually works full-time, and she earns £11.20 a month. Now, to keep her son in insulin supplies, it's £12.40.
Right.
So she actually goes to work to provide her son with his insulin injection. So what we did for that particular young guy was we managed to get hold of a pharmaceutical company, and they've given him a free supply of insulin for the next 4 years. So for him, that's 3 years of not having to visit a medical shop twice a day. So he doesn't have to call in the way to school, have his injection, and then go off to school. He actually can now self-inject. And it's 4 years of the parents not wondering where the next rupee comes from.
That's awful, isn't it?
Yes, it is.
Isn't it awful that, really, more than what she earns goes on his medication? I mean, how do they live? How do they survive day to day?
It is very difficult. It's a tough environment. There's a lot of poverty there. People are lucky if they live in a shack with tarpaulin or metal roofs. And these people walk miles in scorching temperatures, often barefoot, to see us and have a 5-minute consultation so we can actually give them some treatment, give them a window of opportunity to help them best manage and perhaps look for where their next medication is coming from. And ultimately, they're so grateful for everything that we do. It's a fantastic, warming, welcoming feeling. Everything that I do, I come back feeling, actually, I've invested something and I've made a difference to people's lives.
So anybody listening, they want to join you, or they might know somebody who would be interested. Yep. How do they go about that? What do they need to do?
Well, basically, everything's on the website now. So www slumdoctor.co.uk, and through there you can link into Facebook, where there are videos, there are recordings, and there's all the information in there about the events which are up and coming for the March camp. So please do check it out.
Yeah, check it out. I've got that address here, slumdoctor.co.uk. Good luck with it, Tracey, and getting more people to come with you.
Time.
Thanks. Nice to meet you this morning. Thanks for coming in. Tracey Clay. Tracey is a former diabetes specialist nurse at Scunthorpe Hospital. She's going out to India as part of the Slumdoctor project in March. That website address, once again, is slumdoctor.co.uk if you're interested in that. So thank you for your texts and emails this morning. It's a big day for the whole of the Humber region with